Good morning, everyone. I am Bridget Lynn Campanero and I am your reporter for this morning. I will be talking about syphilis. In the year 1905, it is caused by a spirochete called Treponema pallidum. In 1906, the diagnostic tool called was Semantas. And in 1940, they used arsenic, but today they use penicillin. And currently, the diagnostic tool for syphilis in direct examining the treponemas is dark field microscopy. Syphilis comes from the order Spirochetalis and the family Treponemataceae. There are three subclasses of syphilis. It is called Treponema pallidum, a variant form, Treponema partenue, and Treponema caratum. And it is associated with diseases called Behel, Yos, and Pinta. Epidemiology. Syphilis is the most common STD together with chlamydia and gonorrhea, but syphilis is the most common. And syphilis is considered as venereal disease. It is also associated with poverty, overcrowding, and poor hygiene. Included here are the three trypanomatosis, the Behel, Yos, and Pinta. And in 2004 to 2008, syphilis was prevalent in ages 15 to 24. It is higher among blacks than Hispanics than whites. And it has become a global problem because 12 million people are infected each year. So, syphilis can be transmitted through direct contact, congenital, or mother to child during birth, example, and transplacental, men who have sex with men, sexual exposure, kissing, and in some or a few cases through blood transfusion and sharing a bed with an infectious individual. Signs and symptoms. So, syphilis has three stages of untreated syphilis. It is called the primary, secondary, and tertiary or latent. Syphilis has an incubation period from 3 weeks to 90 days. As you can see here in the screen, in the primary stage, the person will develop a chancre. At first, it will begin as papule, then it will evolve to ulcer. It is commonly seen in the genitalia, especially in men. It can be seen in the penis or the discharge of the penis. In females, it can be seen in the perineal region, labia, vaginal wall, cervix, urethra. And it develops inguinal adenopathy or oral cavity. In the primary stage, the chancre will persist for up to 1 to 5 days, and it will completely heal in 4 to 6 weeks without treatment. In the secondary stage, the primary chancre will still appear, but however, it will develop some signs and symptoms such as viral infection, headache, sore throat, low-grade fever, nasal discharge. Blood test is ordered, and you can see there there will be an increase of leukocytes and lymphocytes. So here, it is associated with different kinds of diseases. Especially, you will develop some lymphadenopathy and lesions of the skin and mucous membrane. Also, macular lesions and rashes in genitalia, palms, and soles is present. So, CNS is involved in the secondary stage. However, it can be asymptomatic. It is within 2 to 8 weeks you can develop a secondary syphilis, and on the other side, on the other hand, it will resolve. The secondary stage will resolve within 2 to 6 weeks without therapy. Last is the latent or the tertiary. It is the most destructive syphilis because it has a presence of granulomas or gomas. It produces lesion segments of circles that often heal with superficial scarring. The tertiary stage will also develop a cardiovascular disease because the Trypanosoma pallidum will directly infect the aortic endothelium by weakening the blood vessels of a person, and it will occur as a syphilis aneurysm. So in here, speaking, it will manifest as a seizure or a stroke. The tertiary stage begins at 1 year and lasts for 3 to 10 years if untreated. In your book, you can see there the stages of syphilis. Here. And then let's go to congenital syphilis. Congenital syphilis is a transmission from mother to child via placenta or contacts with infected lesions during birth. It causes miscarriage, stillbirth, or birth defects. It may be asymptomatic at birth, but symptoms will occur within 4 years. Congenital syphilis can be treated at least 30 days before delivery. It can be seen also in children older than 2 years who are untreated, and it will develop diseases. Next is the neurosyphilis. Neurosyphilis can be seen in the part of our brain. It involves our brain and spinal cord. It may be asymptomatic. However, in the symptomatic forms, meningeal syphilis, less than a year after infection, and meningovascular syphilis will occur 5 to 10 years after infection. So that would be all. Thank you for listening. God bless you.